Hi, welcome to another episode of Ask Your Pediatrician. Our topic for today is lymphadenopathy. That means extra lymph nodes.
You sound really smart.
Well, doctors actually learned this special language, and I think those of you who have figured that out, you realize we're not all that brilliant. We hide behind an entirely new language. I was fortunate enough in college to take medical terminology. If it says itis, it's inflamed. Anyway, I could go on and on. It's not that smart, just got a new language. Today we're talking about lymphadenopathy, which means nodes that are enlarged. The most common lymph nodes, I get children in here all the time. Parents are worried. Bottom line, they're worried, does my child have cancer? Because they've read somewhere that lymph nodes are associated with cancer. That's true. But I would say in my career of over 20 years, I've maybe had a kid or two or a handful, no more, where they also had cancer. But every one of those kids had multiple nodes in multiple places and usually an enlarged spleen and liver. So the most common place we have lymph nodes enlarged is right here, the anterior cervical lymph nodes. Anytime you have colds, congestion, sore throats, skin infections, you're going to get these nodes. They get enlarged. Back here, viral infections, posterior cervical nodes get enlarged. If you have under the arm, axillary nodes, that's a little more concerning. Supraclavicular right in this area, way more concerning.
What are the nodes for?
So lymph nodes, I'm going to get to in just a moment.
Tell us now.
You're going to have to hang on there, cameraman. So I'm just going to finish here. There's lymph nodes internally, so sometimes you'll see them on a chest x-ray. They're kind of visible on the chest x-ray around the heart, in the abdomen, but inguinal, down in the groin area, is the other place. So if I have a parent who's really worried about cancer, we're going to do that complete exam and make sure that, it's just isolated nodes here or there. And there's a good explanation for them. The child has a cold, sinus infection, ear infection, eczema, dandruff, some inflammation somewhere. What was that question again, cameraman?
I think it was, what are the nodes for?
What are nodes for? That was the question, and it's a perfect question because here's the thing. Just as your car has oil for lubrication and an oil filter to get all the junk out of the oil, our lymphatic system helps get bacteria, viruses, junk out of our body. And so think of the lymph nodes kind of as your lymphatic system, as your oil filter, as your cleaning immune system. It's just a little part of it, and that's its function.
Thanks.
You're welcome. So, lymphadenopathy is almost always a benign thing, no big deal. You've just got some nodes that are reflecting the fact that there's inflammation somewhere. You have an infection somewhere, you've got an irritation somewhere, and that's that. I'm just going to add one little caveat, and we're done with this video. If that node, let's just say we've got a big node here, and it's extremely painful, that's a different story. Harmless lymph nodes are not that painful. They also are not red and inflamed. If they're red and inflamed, that's an infected lymph node, and I'll use my smart terminology on you and explain that that's called lymphadenitis. Remember, itis, inflammation. Lymphadenitis is an infected lymph node that may need to be treated, usually needs antibiotics to clear it up.
And how do I know if I need to see a doctor about my lymph node, or my child's lymph node being swollen?
So if it's swollen, red, painful, go see your doctor. If you just have some little tiny lumps in the neck, I wouldn't worry about it, to be honest, especially if your child has had a recent cold or congestion or even allergies. That's normal.
So nodes are common with cold and allergy.
Absolutely. I've had a chronic issue with sinuses myself. I can almost always find a node or two. They're just always there.
How many nodes are in the body?
That is an excellent question. We're going to have to ask, is it Jeeves or somebody?
Yeah, maybe in the 90s.
Showing my age. We probably go to Google, right, these days. All right. There are lots of nodes. There's, 10, 20, 30, 40 up in the neck alone, and those other areas I explained, probably over 100 if you counted all the areas internal as well. But
so they have to leave with one thing from this video. What do you want parents to know?
Lymph nodes are harmless unless your child is very ill, or they're everywhere, or they're very tender, painful, red, inflamed. Otherwise, not something you generally have to worry about.
You're a real handsome guy.
Right.